And everything. Welcome, everyone. I have Dr. Naresh Bhatt with me, and we've been talking about dementia and Alzheimer's disease. And what's fascinating is that not only the patient sometimes may not be aware, but early situation, but also recognition by the family members and then the caregiver who is there as the this stage of the disease progresses. The caregiver issues become very large. And so I have a question for Dr. Bhatt here about, please address this whole scenario about the transitional stage and also the caregivers issues that are there. Go ahead.
So you asked me more about the early part of dementia and management, and I just want to go on the record saying that there are 3 stages to make it very, very simple to oversimplify, but these are not very practical. But for the concept to explain, it is important to determine that early stage when it is difficult to notice problems, but the patients are having significant problems, but intermittently, and they look fine, they may be acting fine, they may even be working, socializing, having some position of responsibility in the society, but they may be having occasional problems with making judgment or getting lost or not being able to make certain decisions or forgetting repeatedly the appointments or uh, social events. So things like that are because of neuronal disconnections in the early stages due to the plaquing of the brain uh, and neurocirculatory connection disturbances. So they may have problems with doing certain things, judgment, power, and higher functions, remembering and getting lost and getting disoriented, confused, hallucinating, having sleep problems or reversal of sleep. These are some of the symptoms that can happen in the early stage, and the caregiver will presume is an elderly child, a son or a daughter of the person, maybe a mom or a dad, and what they should do, what should the caregivers be doing in the early stage. And I am talking about this early stage when things are apparently not too bad. They look fine. The person is denying there is any problem. And they say they can do everything on their own. They can drive. They go out, but they occasionally miss the appointments or they may sometimes get lost or the keys or where they park the car. So it is for this kind of patients that the caregivers need to sit them down and help the people, help the patients develop a significant routine and make them comfortable and make things easier for them and make planning like bill pay, put it on automatic auto pay and do things not for the parents but with them, set a reminder system, keeping the person active socially and busy and developing important documents, making sure that they have uh, arrangements made for the living will, advance directive, durable power of health, and power of attorney, and have a will done. These things are important, and it's the job of the caregivers to make sure that the parents who are hopefully maybe living by themselves, as long as there is a spouse, there's no problem. But if the person is living alone, we have to make sure that they have all this important information, contact in case of emergencies, and they have some information given out by the local police department where there is called a vial of life that the patient can fill out and put in the fridge, and they have the contact information, name, the significant other or whoever needs to be contacted, their names, phone numbers, email addresses, their health history, and they have what medications they are taking in case they are found on the floor or confused or not available, not in the house, and in case somebody goes out searching for them, that this information is provided, and this is the job of the caregivers to do it. Now, as the disease progresses, there is more hallucination, sleep disturbances, more memory loss. And the way you know that there is advanced disease is because the person's more and more neurons are lost, brain is shrinking, and it is atrophying. So the person is unable to take care of their daily routines. They are unable to do their activities of daily living, and they need extra help, like, for example, getting dressed or going to the bathroom. They might have accidents or their hygiene is bad. These are the signs uh, that it's a telltale sign that the person is needing more care. So then, in that case, the significant other or the power of attorney or the next of the kin have to take the responsibility over as caregivers and designate somebody in the neighbor or as a person who lives close by to check on the person frequently. And that's the time when more care is needed, and the caregiver doesn't have to do it himself or herself. They can designate a significant other or have a part-time caregiver who comes 3 times a week or twice a week or several hours a day and make sure that the person's kitchen sink is clean and the bathroom is clean, the person has showered and having clean clothes. And as the disease progresses, they will need more and more care by themselves, including getting in and out of bed, going in and on and off the toilet, and showering and grooming, and all these activities. They are not able to do anything by themselves, and they get confused in their own house, and they gradually forget who their relatives are. They forget to recognize their own self or their spouses, children, grandchildren, their pets. They forget who they are, or they don't know the names. So as the disease gets progressively worse, they need more and more care. More care, they need 12-hour care or 24-hour care. If they are not able to do anything by themselves, then either 24-hour care is an option, or placement in a nursing home, or a placement in a memory care unit might be in order.
Excellent, excellent outline of how the disease can progress and how the caregiver's role needs to be improved. I have one small question along the lines, and that has to do with when safety. Of course, safety is one area that if you have areas of safety, the person does not recognize around the house, like cooking and things of that nature, so they can hurt themselves. So that's one of the things that will be essential.
The best solution would be to, if the person who's a power of attorney or adult child is not living close by, designate somebody who can check in on your dad or mom and make sure they didn't leave the stove on and something is cooking on the stove, or they didn't put some lights on, or they don't have anything dangerous. And also the safety concerns for the person who's living by themselves, to make sure there is no clutter in the house, no extension cords, no papers, no dog ears of the carpets, no toys, no pets, because pets can make them fall too. So all these things have to be watched. Make sure that the house does not have very loud noises, but it's not completely silent, and the house has to be made fall proof, and somebody has to be checking in on them and making sure that they're safe. They can come and look in and leave.
Yeah.
Make sure
Nowadays
there are
with
no faucets running or lights on all night long, so somebody can come and look in on them.
yeah,
Neighbors
nowadays
can-
with CCTV cameras and stuff.
Right. A lot of adults have done that for their children, for their parents. Yes.
As we take care of children also.
There are a lot of different things that go into it, and obviously, for lack of time and for other reasons, it's a vast topic and it's impossible to cover everything.
Yeah.
We can cover small bits and pieces as needed.
Thank you very much. This was extremely helpful from the standpoint of how difficult the situation is. But there are many things that we can be aware of and can do. Thank you very much for your
You're welcome.
participation.